Hi everyone, my name is Ariana and this is my video reflection for the critical care sim on October 3rd. So this simulation did not go as well as I had hoped. I felt overwhelmed and unprepared for my first attempt, and I realized pretty quickly that I did not know the algorithm as well as I should, or the process of doing a cardiac arrest code. And because of that, I wasn't able to fully understand or keep up with the process that was required for this simulation activity. I also don't have any real prior experience in this area in real life. The last time that I did any sort of emergency response like simulation was when I was a lifeguard when I was 16. So I just definitely don't feel comfortable yet running a code or being confident in making the decisions and calling the shots during a situation like this. In terms of feedback, I think I need some improvement across the board in this class. My actual clinical skills weren't very strong in this scenario. I wasn't able to show my clinical skills that I've been working on all year. For example, when I was bagging, I didn't make sure the head was positioned properly or the airway was open. So that is a simple fix that I could utilize, like tilting the head back and making sure the airway is straight so the patient can receive a good breath. But in the moment, I did not do it correctly. I also need to be much more familiar with the monitor, or all the different types of monitors that there are, and how to quickly recognize each line and what it represents. So I could have recognized and named the rhythm, and knowing which rhythms to call that would require a rapid response is something that I will work on. With that being said, one strength that I did bring to this simulation was teamwork. I think I worked well with my group, and we all supported each other and stayed engaged, even if someone was struggling with a certain skill. So looking ahead, this entire simulation did challenge me as a nursing student, especially my confidence as going forward as a nurse. It made me realize that I need to work on my clinical decision making in fast-paced environments, and I also need to learn how to better manage my own stress in high-pressure situations so that I can think clearly and respond appropriately and apply my clinical skills. My plan moving forward is to spend more time studying the ACLS algorithm, reviewing rhythms, practicing airway management, and practicing effective CPR technique. I think with more repetition and preparation, I can feel more confident in my abilities in this type of situation the next time that I'm in a similar scenario or in a real life situation. So overall, this was a humbling but valuable learning experience for me, and it showed me where the gaps in my skills are, and I now have a clear direction and path for growing as a nurse. Thank you.